Hey everybody, Dr. James Stirrett here. Today we're going to be talking about the 4 Semaglutide tips when microdosing Semaglutide for maximum weight loss. The tips that I'm about to share with you today are not only how to microdose the Semaglutide and do this safely with your provider, but what lifestyle actionable tips can you implement to ensure that you lose weight quickly throughout the process and can keep the weight off long term and ultimately come off the Semaglutide if that is what you and your provider decide. Let's dive into it today. Now, I want to explain Semaglutide really fast to you guys so you have a clear understanding of how this medication works and what the rationale for microdosing actually is. So very quickly, what this medication does and this class of medications do, they help stimulate the GLP-1 receptor for insulin. And we have them in the gut, we have them in the brain, and throughout the body. What this will do is it will decrease insulin, resistance, and ultimately blood sugar, but it has this effect of making us a little less hungry. It reduces the rate at which food moves through the digestive tract. Ultimately, you end up with less carb cravings, less wine cravings, sugar cravings, and eating just a little bit less food in general. When we get a little bit of that increased stimulation to those receptors, it can be extremely helpful, very valuable for patients that are struggling with a GLP-1 deficiency, which we have found that many people struggle with as we age. GLP-1 receptors go down in quality. This medication is very necessary for some. But we hit this discrepancy where a lot of doctors don't know how to appropriately dose Semaglutide. All they see is what it says on the Wegovy website. Hey, every 4 weeks, increase this medication up to 2.4 milligrams. But I'm here to tell you that you don't need to be on 2.4 milligrams unless you're severely diabetic, you're struggling with other severe health problems. You likely don't need that much medication to be able to successfully lose weight, lower your blood glucose, and decrease insulin resistance with these medications. So most doctors are effectively treating their patients like they're severely diabetic, ramping the dosage up. It's increasing side effects, increasing their lifelong dependency. There's a fly buzzing around here. Increasing their lifelong dependency of the medication. So it makes it more difficult for them to ultimately come off of the medication if they chose to do that. This will cause a whiplash rebound in weight for most people. So how do we avoid these things? This is the rationale for microdosing. We don't want to give that receptor, those GLP-1 receptors, more stimulation than they ever would have had. And when you bump somebody all the way up to 2.5 milligrams, it's going to blow them out of the park. So we got to dial things way back and say, hey, how can we go about stimulating these receptors in a way that's physiological, meaning that it's around the amount that a healthy person's GLP-1 receptors would be stimulated? This is the concept of microdosing Semaglutide, and we're going to be getting into these 4 tips right now. So tip number 1, and please take this. This is not physician advice to you. You have to talk to your doctor about this. If you have Semaglutide at home, don't go wild west and just start dosing it on your own. You have to talk to a provider about this, like myself. For starters, tip number 1 is the actual principle of microdosing. What constitutes microdosing? And I don't think there is no set definition of what microdosing is. There's nothing in the literature that says what this technically is. I would say that my personal definition is anything 0.25 milligrams and below. Let's just say that it says 0.25 milligrams is a starting dosage on Ozempic, Wegovy. Most weekend courses that doctors learn about will start people off at 0.25, but they will quickly ramp that dosage up. Whether people are having results or not, their answer to someone not losing weight is always a dosage increase. And this is a big no-no. You don't want to go there first. What we always want to think about, and this is just like the most massive tip that I could give to a patient, a friend, a family member, other providers, do not ramp up dosage because someone isn't losing weight. That's not the right way to look at it. Ultimately, you are offering GLP-1 stimulation to people even at low dosages. You need to start to consider other lifestyle things going on that are holding that person back from losing weight to begin with. What has to happen here is 0.25 milligrams and below. I would consider starting at half of that, 0.125 milligrams per week is a great place that I would like to start with somebody typically. Depending on their size, weight, we might change this. But blanket statement, that's where usually I would start. And instead of just increasing the dosage if someone isn't seeing success, not having appetite stimulation, what I would like to do in that case is start increasing the frequency, not increasing the dosage. So maybe every 4 days, every 5 days, having them inject again instead of waiting for every 7. That is what I would consider to be microdosing, because what will happen is ultimately a lot of times people will feel a lot of appetite suppression and feel the effects of the medication day 1, 2, 3, and then the rest of the week they're starving. That's just a really good sign that you need to increase the frequency, not necessarily the dosage. So tip number 2, let's say that you're microdosing and boom, you're not losing weight. You're like, man, maybe I was losing weight and things stopped. Maybe you've never lost any weight on it yet. Instead of increasing that dosage, what you want to think about is the question, are you having regular bowel movements? Meaning, are you going to the bathroom like a well-formed bowel movement at least 1 time per day? Becomes something that's extremely important, because if you're not going poo every day, then your body is not eliminating. It is not getting rid of toxins, meaning that you are retaining the toxins, you're retaining the weight, retaining the toxins. That is going to be pro-inflammatory for you and in your body. It's going to cause water retention. You're not going to really lose a lot of weight in those types of instances. So if that's the case, consider fiber. I really like psyllium husk fiber. 1 tablespoon, 1 to 2 tablespoons per day for patients usually works extremely well. It's cheap. It's over the counter. For almost everyone, it's going to be non-harmful. And so that would be something that you could pair with making sure that you're drinking plenty of water, maybe a quality probiotic to help move things along. And you'd be shocked at how many people just need to start going to the bathroom and change nothing else in order to be able to start losing weight. So that's tip number 2. Tip number 3 is the second step in controlling water weight, and that is what you are putting in your body, the foods you are consuming and the liquids that you are drinking. So you want to eat a anti-inflammatory style diet while you're on semaglutide. Now, I've personally designed a diet that works extremely well with my patients. Really, at the end of the day, what it is it is an anti-inflammatory style diet that's high in protein. I am having patients avoid dairy, legumes, and nightshade vegetables. Those are really the core basics. Now, what about alcohol? Everyone wants to know if they can drink alcohol in semaglutide. I would really tone the consumption down, especially red wine, white wine. I find it just throws a wrench in people. Had a patient recently who was doing all the right things. She was on the perfect dosage. She was eating an excellent diet, but she was drinking 2 glasses of red wine a night and not losing a pound for months. And it took, cutting out that wine to start seeing the weight just fly off. And tip number 4, and this is my personal favorite to talk about today, is get some lab work done before you start your semaglutide journey. Before you get on a GLP-1, it's so critical to get some baseline labs done. Now, your doctor, you might think, well, my doctor did. And maybe they checked the cholesterol and like a complete metabolic panel where they just do a snapshot blood sugar. Maybe they even did a hemoglobin A1C. Awesome. The fact of the matter is there's so many other things out there that you need to be checking in order to put everything on paper and really see the full picture of your metabolic health. I would argue that a fasting insulin is probably the most important thing to check, along with your A1C and your complete metabolic panel. I would also, if you can get your doctor to do this, throw in on top of your lipid panel, do like a fractionated lipid panel where they're looking at the particle size counts of the lipid molecules, apolipoprotein B. But now I'm getting a little picky for you guys. If you have to hold on to one thing, make sure that they're checking all aspects of your blood sugar, fasting insulin. They're doing the complete metabolic panel that also includes a snapshot blood glucose and a 3-month average blood sugar, hemoglobin A1C. Get that baseline, and then you want your doctor to check this periodically with you on the medication and make sure that these things are looking better, not worse. Also, man, if you're a doctor, you're getting way too much value out of this right now, because I'm going to share with you the biggest hack here when it comes to fasting insulin. Do I want to share it? Yeah, I'll share it. Okay. I don't even want to share this because it's too good, but when you're starting someone on semaglutide, microdosing semaglutide, deciding on what dosage, your fasting insulin is the biggest deciding factor for me as a provider on how much I'm going to put you on. Why is this? Fasting insulin, anything over a 5 is typically signaling insulin resistance. But let's say you come in, you're struggling with weight gain and a bunch of other things going on, inflammation, and your A1C is a little high, but your insulin is not over a 5. I'll still put you on semaglutide. I would still put someone on semaglutide in that case. However, I might not put you on as much, because if you already have a suppressed insulin level, you don't even need that starting microdose level of 0.25 milligrams. That's going to be way too much for you, and you're likely going to have side effects if you fall into that camp. So I would argue to you and to your provider, get that fasting insulin done before you start. So you could say to your doctor, well, wait a minute, my insulin's already pretty low. Like, obviously the Ozempic, the Semaglutide, the Wegovy, that's just going to drive the insulin down even more. Why, like, what's the point of this medication? What's the point of putting me on this much of the medication? Can we start lower? That's a great conversational piece as an informed patient. You want to be an informed patient. You need to be empowered with this information, because what's going to happen is you overstimulate that receptor. You are going to shut your digestive tract down. You're going to get nauseous. You're going to get constipated. You're not going to be hungry ever, and you're going to have a terrible experience on the medication, and you're going to ultimately be like, oh, this medication didn't work for me. It worked for my friends, but it didn't work for me. It had bad reaction, and it's like, nope, you didn't have a bad reaction. You just took way too much of the medication. So the key takeaways here are microdosing is extremely helpful. It can reduce side effects. You can still lose weight, but you need to pair the semaglutide with other lifestyle techniques, making sure that your digestive system's good, making sure that you're going to the bathroom, you're eating quality food, drinking quality water, enough water. These are the conditions that need to be met to be able to microdose and lose weight on semaglutide. I hope you guys enjoyed this content. Please comment. I love your comments, good or bad. Like and subscribe. I will see you guys in the next video. Take care.